July is Sarcoma Awareness Month, the perfect time to raise awareness of this devastating cancer affecting young adults. Joining us this morning is Dr. John Charlson and his patient Megan to help educate our viewers on early diagnosis and how to find a treatment center. Good morning to both of you.
Good morning.
Good morning.
What is synovial sarcoma and what are the most common symptoms?
So synovial sarcoma is one subtype of a rare cancer called sarcoma, and sarcomas arise from soft tissues like muscle or fat or other soft tissues, or can arise from bone. Synovial sarcoma is a subtype of sarcoma that tends to be seen in younger adults than a lot of the other sarcomas. Symptoms can be, a swelling or a lump that you can feel that is getting progressively bigger, or a pain somewhere that you can't really explain, and it doesn't get better after a month or after some period of time. Like, we all get aches and pains and they usually go away. But so those red flags would be signs that you'd want to bring up to your doctor and talk about, should you get some imaging to check it out.
So what makes synovial sarcoma such a devastating type of cancer, and how does it impact the lives of patients and their care partners?
Well, the treatment can be very involved and can involve radiation therapy and intensive chemotherapy. Can involve a really major surgery to try and get the tumor completely removed, and all of those things can leave patients with some lasting side effects, which Megan can tell more about than I can, really.
Megan, let's hear
Yeah,
about the side effects. How did you get started? When did you start noticing this? And how did this go for you?
yeah. So I went through a pretty lengthy diagnosis period. I first started experiencing shoulder pain, as young as my middle school years, and by the time I was 15, it was pretty debilitating. I had seen multiple doctors, gone through a lot of physical therapy, and had many x-rays done. But unfortunately, with that soft tissue sarcoma, an x-ray is not going to give you a diagnosis. So for me, getting my diagnosis required my physical therapist with me by my side at a doctor's appointment, helping advocate for me and insist on an MRI scan to get that diagnosis, which turned out to be a tennis ball sized tumor in my shoulder. So once I was diagnosed, I was quickly brought into Dr. Charlson and his team, and that included, radiation, chemotherapy, and a pretty extensive shoulder surgery, quickly after my diagnosis time. Luckily, though, I can speak from the lens of being 5 years cancer-free.
I love the tattoos on your head, Megan. I like
Thank
those.
you.
Those are great. So why is
Yep.
early diagnosis so critical for this type of cancer? And what are the challenges to receiving a diagnosis, doctor?
Yeah. When these are caught at the earlier stages, the odds of successfully curing them are higher. And if we catch it before it's metastasized, we're able to treat it with the potential to cure it. If it's already metastasized or spread to the lungs, say, by the time we diagnose it, then the odds of cure are much lower. The diagnosis is tricky because Megan, young, healthy person, and you're not really expecting to find a cancer in a young person. So her story is not all that uncommon. People, you're thinking it's musculoskeletal pain or shoulder injury rather than thinking tumor. But, fortunately, Megan was persistent and pointed out, hey, this pain is not getting better. We don't really know why it's there. We need to look further. And thank God she did.
Most guys, not Megan, but guys, period, males were like, oh, there ain't nothing going on. I'm doing great. You know how it is.
Yeah.
So why is it
Yeah.
important to find physicians and multidisciplinary treatment centers, also known as sarcoma centers of excellence, that have experience with this disease?
Hopefully you can still hear me. I think my speakers just did something weird, but yeah, these are the surgeries are pretty unique surgeries, and the chemotherapy and radiation protocols are different than a lot of cancers. It's a rare cancer, so it is important. We know outcomes are better when you're treated at a center that has experience with these. And for instance, you guys have the Washington University Siteman Cancer Center, and they're a sarcoma center of excellence for sure. So it's that if someone ends up with a diagnosis of a sarcoma, you probably should consider getting to a sarcoma center like that.
Megan, what was your experience like when you went through all this treatment?
You know, oddly enough, as scary as it was to get diagnosed with cancer when I was 20, you know, I was excited too, though. I finally had an answer to that pain that I had been dealing with for years. And I knew I was in the right hands. I couldn't be more trusting of my doctors, you know, given the fact that they are one of these sarcoma centers of excellence. So I feel really fortunate there. But, you know, on the contrary, these treatments are really harsh. So, you know, long term, it can be, you know, stressful for survivors to navigate long term side effects, as well as, you know, just dealing with joint problems as a result of the sarcoma itself or the surgeries to remove it.
Megan, what would you say to other people about the treatment and how you handle it?
You know, the advice I always give to, you know, those who are struggling to get a diagnosis is to advocate for yourself, you know, first and foremost, but to really just, you know, keep track of the pain that you're having and really make sure that you're being clear about its progression. Because like Dr. Charlson said, it's when things aren't going away that should be, you know, ticking you off to get an additional opinion or additional imaging done. But, you know, as far as people in treatment, rally the troops. We all have a lot of people in our corner, and I think it's important to, you know, remember to mobilize that group of support for yourself and, you know, use them to your advantage. Cancer treatment is tough. You don't have to do it alone.
There you go. Dr. Carlson, what types of questions should patients ask a sarcoma specialist?
Well, I mean, I think it's good to ask, you know, what's your rationale and why are you recommending the treatment you're recommending, and make sure that makes sense to you, and the research you might have done on your own. Ask about the side effects, including what are the potential long-term side effects that I might be dealing with, so you can be proactive about dealing with those, and ask about what's the best way to stay healthy over the years, because that's really important for the best outcomes as well.
Now, where can we go for more information?
The Sarcoma Foundation of America has a really good website called curesarcoma.org. It's a good website. And for synovial sarcoma specifically, there's a website, flagsynovialsarcoma.com.
Now, Megan, do you have your own social media platform where you help people out?
You know, I have my own personal accounts, and I can speak to the fact that there's kind of a unofficial network of survivors out there who kind of lean on each other. You know, just because as a rare cancer, it's common for newly diagnosed individuals to turn straight to Instagram and, you know, find other people who have had this experience. So, you know, casually, more as friends, yeah, we definitely do keep each other supported.
You seem like somebody who's very supportive, very strong. I'm glad to see that you're doing well. I've been speaking with Dr. John Carlson and his patient Megan. It is Sarcoma Awareness Week. Thank you to both of you to joining us on Morning Blend. And again, Megan, I still love that tattoo.
Thank you. It definitely made being bald a little more exciting.
Thank you very much.
Thank you.
Thank you.